It's just a review, just a quick review on the drugs. First drug I'm going to review is the antibiotics. With the antibiotics, you have the broad spectrum and the narrow spectrum. Um, with antibiotics, you want to assess for signs and symptoms of infection. And of course, with any med, you're going to assess for allergies. Some meds that are antibiotics are penicillin and cephalosporin. The N ending gives it away. Also, you need to use another form of contraceptive because it could cause your birth control not to work. Also, you have the anti-infective, and that's the bacteriostatic or bactericidal. The nursing assessment that you need to do before is a CNS, which is the culture and sensitivity. And the meds is tetracycline and aminoglycosides. Analgesics, that's going to be like your narcotic and non-narcotic, so we know it's going to relieve pain. These are things such as morphine, codeine, aspirin, Motrin, or Advil. If someone has an allergic reaction to morphine, then you could give them Narcan to reverse the effects. Before you give a narcotic or non-narcotic, anything for pain, you want to assess their respirations, level of consciousness, pain rate, and their other vital signs. These narcotics can cause constipation, and they can slow down respiration. If a patient has had a head trauma, you don't give it because it increases cranial pressure, and the drug may change their level of consciousness. And with any narcotic, before you can give another one, you need to check the last time that a narcotic was given. A side effect of it, I said, was constipation. Orthostatic hypertension, it lowers the blood pressure as people are trying to get up out of bed. So you want to tell them to get out of bed slowly and dangle their legs before they get up. Hypnotic and sedatives, that's like your barbiturates, benzodiazepines, phenobarbital, Seconal, Ativan, Valium, diazepam. These treat seizures. Also, they produce sleep and give a calming effect. So you want to monitor their vital signs, their respiratory rate, their level of consciousness, and you want to watch them for respiratory depression. Adrenergics, that's like the catecholamines and the non-catecholamines. The meds, epinephrine, norepinephrine, dopamine. You need to monitor their vital signs, the side effects, the restlessness, headaches, and steroids. That's like your cortisone or your prednisone, and it treats the side effects of prolonged therapy. You need to watch that. But you know, any steroids could treat different things. You don't need to just get off of a steroid. You have to be tapered off of it. So it's a gradual getting rid of this drug. Weight gain may happen, immune system decrease, respiratory, GI distress. You got to monitor their blood sugar. Infections may increase, and the client needs an anti-acid to decrease GI upset. Insulin, you have your type 1 insulin dependent and type 2, and that's the type 1 is insulin dependent. Type 2 is oral, meaning they don't have to have insulin, they have like a pill. Always perform an AccuCheck before. Cardiotonics, they strengthen contractions. A med like this would be like digoxin, where you know you need to do the apical pulse for 1 minute before. It may cause some swelling from fluid overload. Ventricular contraction increases. It increases the cardiac output, but it decreases the heart rate. Antiarrhythmic, they act on the heart's electrical system. And meds such as, these are the meds such as verapamil, Pronest, and Enderal. You want to monitor their vital signs, congestive heart failure symptoms, edema, and shortness of breath. Vasoconstrictors, they control superficial hemorrhage, increase heart pumping, increase blood pressure, and these are the meds such as the Levophed, and you just want to monitor their vital signs. Vasodilator, monitor their blood pressure because it can lower, and tell them to rise low from a sitting position because they can have the orthostatic hypotension. These dilate the blood vessels. This treats peripheral vascular disease, coronary artery disease, and hypertension. These meds increase the lumen size of the vessels.